Hi, everybody. Welcome to the Meddkit channel. Today, we are interviewing Dr. Sue, and Dr. Sue has teamed up with her daughter, and they have their own practice together. Super incredible. Just a little intro to Dr. Sue is that she graduated from Simmons College with a BS in Home Economics Education and a BS in Orthoptics. As a part of her orthoptic curriculum, she took the Harvard postgraduate course in ophthalmology and completed a 15-month internship at the Massachusetts Eye and Ear Infirmary in Boston. She went on to graduate from the Pennsylvania College of Optometry with honors. So welcome, Dr. Sue.
Hi.
How you doing?
Good.
Good. So tell us, how did you get into your specialty?
It's very simple. I'm second generation optometrist. I grew
Ah,
up, my father was an optometrist, had a practice in the house, always wanted to do it because I always wanted to follow in his first steps. So that's why I started taking orthoptists. Then I had worked for 7 years as an ophthalmic technologist. So I assisted in surgery, both major and minor. I did contact lenses, I did refractions, and my bosses said, you want to become a doctor, and say the rest is history.
that's awesome.
Yeah.
So what is unique about your practice?
Well, the first thing is that we're mother and daughter, and the daughter is the boss, not the mother. So that's what usually makes it. Usually, when you have the older generation and the younger, it's the older generation's the boss. In this case, my daughter owns the practice, and as a mom, I'm there to support her any which way I can. So there we go. Um, I would be bragging if I tell you my daughter is so talented, because she is. She is residency trained optometrist, and she too graduated from the top of her class at Pennsylvania College of Optometry, part of Salus University. And before COVID, she was a consultant down there and in the clinic down there. So that's what's really unusual. Is one is led by, it's two women, solo practitioners. We're not affiliated with any companies such as VisionWorks or LensCrafters. We're independent optometrists. We are mother-daughter. We are both in there to support each other, although she owns the practice.
Well, I'm not surprised. Speaking to you before and hearing how amazing your daughter is, the apple doesn't fall far from the tree.
Oh,
So,
yeah.
so what kind of patients do you see, and what kind of patients does your daughter see?
Well, Dr. Heather takes care of more of the medical end. I take, my specialty is contact lenses. Dr. Heather also does contact lenses, but her specialty is medical optometry. There's over 200 systemic diseases that can be picked up by routine eye exam, and we bound to be as thorough as can. So if you have one, we want to be the people picking up, and if we do, you get referred back to your primary care doctor. Today, there's an influx of diabetes, which is probably even worse now with COVID and everybody sitting around, but diabetes is on the increase. And diabetic eye exams are mandated as part of most people's care to have one a year. We do diabetic eye exams, we do routine eye exams, we check blood pressure, we check, you name it, we're there checking it all out. We have the latest in technology, and we give what I think the best eye exam you can in Bucks County.
Very nice. So, is there anything that you wish people knew, understood about the health of their eyes? For dentists, it might be floss more, but what can people do to keep up with their eye health?
The first thing is have a routine eye exam on a yearly basis. Again, as I said earlier, systemic diseases can be picked up from an eye. Even though your vision might be 20/20, does not mean that your eyes are healthy. You can have peripheral retinal problems. You can have glaucoma. You can have something as simple as a retinal tear or retinal hole without any symptoms. You can have changes to the retinal vasculature, all of which you can still have 20/20 vision and think your eyes are perfectly healthy when they may not be.
That's really great information, and that's my story. I'm the 20/20 vision girl that's never seen an optometrist, so I better get on that.
You gotta get on that. Right.
So tell me about how you and your daughter are handling the pandemic. What happened when first things started to happen, and what are you doing now?
Okay, well, we did close for a couple weeks and we did maintain a phone presence. So we did telemedicine. If you had a problem with your eye, and that could be examined via the computer without coming into the office, we handle it that way. For routine eye exams, we just open when the CDC recommended us to open. What do we do? Well, we both wear masks. We only admit one patient into the office at a time. We
Mm.
check the blood, we check the temperature, and we ask the standard questions about changes of smell, changes in cough and breathing, and hopefully everybody, or it's not contagious that we admit in, but we only admit one. Everything gets sterilized and wiped down between patients, including every frame the patients try on or handle.
That's a
So
lot
we
of
do a
cleanup.
lot more running around.
Yeah, no, that's a lot, but that's great that you really care about your
We,
patient's health, your health, really important. So that's wonderful to hear.
we
So
did
what do you think the future of your practice looks like with your daughter?
I hope it's coming up roses. But we did pick up the one thing forgot to say. We did also purchase a new air purifier that's supposed to
Wow.
take care of any viruses that's in the air. So
Super
that was
smart.
the added to that. Yeah,
Yeah, a lot of people have been buying them and very helpful. So that's
I
great.
hope so. Will remains to be seen. But the practice I hope will be coming up roses.
I'm sure it is and will be.
Good.
So, Dr. Sue, how can people get in touch with you and your daughter?
We have a very strong internet presence. We post regularly to Facebook and Instagram, and our website is brighteyes2020.com, or you can call the office at 267-485-1414, and we'll be happy to make appointments. And we do urge people, if we're not here, leave a message, because I get a text every time somebody does leave a message on our answer machine, and I call them back.
Perfect. Well, thank you so much, Dr. Sue. We really appreciate having you here, and we hope to have you back pretty soon.
Thank you.
Thank you.